The Dopioid crisis, a bulk health emergency. The national dopioid crisis has finally been declared a national health emergency. Thousands of Americans each year choose to suffer the tragic death of overuse of narcotics and all the euphoria that follows. Treatment costs are very high, assuring solid profit potential for those providing treatment. Analysis of the financial loops of intoxication, euphoria, crime decline, and treatment, or death, right, or return to resume a new cycle of addiction and euphoria brings us to the happy realization that Obamacare can easily afford to pay for the problem so long as youth subsidizing the insurance market are available to pay for drug treatment for their peers over and over, yet only if the top 1% of income earners are given substantial tax breaks, to be then freed to create minimum wage temporary jobs for the middle class. There aren't so many people with health issues that are not created through free will choices that dopes that use narcotics freely can't demand free treatment from the government. And most mental and physical maladies that arise involuntarily require expensive treatment too. Those sick people should just share. Dopioid treatment or concentration camp centers located around the nation can standardize dopioid withdrawal technique. Bulk processing of dopioid addicts may be facilitated with the use of select closed military bases partially adapted for reconditioning dopioid addicts at low cost. It might be useful to have the entertainment industry that supports dopioid social ethic to merge with dopioid drug producers and dopioid withdrawal drug producers, insurance companies, and drugstores in a grand dopioid corporation to maximize efficiency in the cycle of euphoria, withdrawal, bland interval, and new euphoria, etc. DT centers could be modeled on Guantanamo Bay terrorist interrogation detention centers. New dopioid inmates would have their hair shaved and receive vinyl jumpsuits that read in bold and very small letters with a nice 60s hippiest lettering font, "I'm a dopioid moron." Each dopioid addict will have a personal kennel yard with a large plastic dog house style plastic igloo to a home behind a 10-foot razor wire top steel fence. Guy Lombardo music would cycle continuously for the pleasure of dopes through camp loudspeakers. Each dopioid inmate would be safe and secure with a personal guaranteed washed blanket and steel bowl for feedings twice daily with generous portions of a bag of all food group kibbles and bits, in addition to 3 quarts of water. An emergency medical response team would be available to help inmates if required within minutes. When the 21 days of liberation were over, the former dope would receive free transportation back to his town of choice, or her, or it, if they've gone through transnuderization procedures already. The public would be billed no more than $21,000 per dope.